What's going on, everyone? It's Alex here from Alex Physio. Today I'm going to be going over 5 lessons that I've learned after assessing over 1,000 people dealing with back pain. That's a lot of backs. And while every case is unique, there are a few things that I've seen come up time and time again. Stuff that I wish people knew before they ended up in pain. So let's get right into it. Lesson number 1, hurt does not always equal harm. This one is huge, and honestly it surprises a lot of people. Just because something hurts doesn't necessarily mean that you're causing any actual tissue damage. I had patients walk into the clinic with really scary pain. Like they can't bend, they can't move, everything is so bothersome and they're so sensitive. And when I look at their scans, it shows nothing or very little. Then I've had people come in with MRIs that look like a hot mess. You got bulging disc degeneration, severe arthritis, the whole 9. And they feel totally fine, or they have very little symptoms. So what I've learned from that is that pain is not just about tissues and tissue damage, it's about sensitivity. Your nervous system can turn up the volume when there's no serious injury, and things like stress, poor sleep, or even fear of movement or fear of the pain can make the symptoms worse. So if you're hurting, try not to panic. Your body isn't necessarily broken, it's just sounding the alarm, and we can work with that. Obviously, there are red flag findings that you have to be mindful of, but for the most part, this isn't something that you need to be too concerned about. Lesson number 2, motion is lotion. I get it. When your back hurts, the last thing you want to do is move. Most people think I should just lie down for a few days and wait it out or wait until the symptoms get better. But in a lot of times that can actually make your symptoms worse. Your spine and your body and everything, all your systems love movement. And when you don't move for a long period of time, your body can stiffen up, your muscles can tighten, and you're not getting that mobility and that blood flow that you need to help with the healing and help with the tissue sensitivity. I'm not saying go and deadlift 300 pounds on day 1, but gentle walking, light stretching, just a little bit of movement, even something little goes a long way, and you want to try to progress to it. And I tell people, don't wait until you're 100% pain-free to start exercising, start moving. Just do what you can, start at a level, and then slowly build up to it. It's called graded exposure. Lesson 3, don't let your scans scare you. This comes up all the time. Someone gets an MRI and sees words like degenerative disc disease, severe arthritis, disc bulge, disc herniation, and they get scared. And again, I understand, it sounds serious. But here's the truth. Most of those things are normal. We've seen studies where people in their 30s, 40s, and even 20s with zero back pain still show these issues on their scans. It's kind of like gray hair or wrinkles, just happening inside your spine instead of outside. So if your doctor or therapist tells you your MRI shows some wear and tear, don't jump to the worst case scenarios and think that you need automatically surgery. The scan is one piece of the puzzle, but it's not the whole picture. How you move, how you feel, how you function matter way more. Lesson 4, core strength is not the gold standard of low back pain rehab. For years we've heard that strengthening your core is the answer if you have low back pain, and if you have back pain it's because your core is weak and you need to build up your core strength. And it may help, but it's not the full story. And I've seen patients who have done all the core exercises are always super keen and aware of their core when they're moving in different positions, and they still have these symptoms. So it's not necessarily about increasing your core strength or moving with more rigidity. It's about trying to improve their general strength, overall strength, managing stressors, moving more, walking more, moving with less rigidity and more flexibility, and going from there and building off of that. There's no research that supports that core strength is better than just a general strengthening or mobility program with individuals who have chronic low back pain. Lesson number 5 is what you believe matters a lot. This might be the most underrated part of recovery, is your mindset. I've seen it over and over. 2 people with the same injury, similar pain levels, similar MRI and imaging findings, and one comes in and believes they're fragile and doomed, that they're never going to get better, and the other trusts the process and believes they'll get better. Guess who recovers faster? Beliefs shape behavior. If you're scared to move, if you move less, if you believe that your back is broken and you treat it like glass, and that creates a vicious cycle. You move less, you become more fearful, it affects your mental health, it affects your job, it affects your relationships, and this causes you to move even less and have more pain. So the key is that to try to break that cycle is to slowly move, to exercise, to understand that it's not just the physical nature. And we call this the biopsychosocial approach. It's not just looking at, what's going on in the MRI, it's all the other pieces that play a role in trying to work on optimizing those in order to get you back to whatever your goals were. There are 5 lessons that I've learned after working with over 1,000 people with low back pain. Back pain is very common all around the world, but it's also treatable. If you don't get anything from this video, just remember, pain doesn't always equal tissue damage, hurt doesn't always equal harm, you're not fragile, and movement is usually the way forward. Obviously, there are circumstances in which surgery or other forms of intervention like injections or other investigations may be warranted, but for the most cases of low back pain, they do get better within the first 6 weeks to 3 months, and they can be resolved from, a little bit of reassurance, exercise, mobility, movement, and patience, and that can help with a lot of individuals. And just being aware that your body has a tremendous ability to heal, and that the trend to recovery can be in general up and down, but overall, if it's just general low back pain or mechanical low back pain, or even discogenic pain, that this does get better in the majority of cases. Let me know what you thought about this video. Do you have back pain? Are you struggling with back pain? Were there any lessons here that you didn't know about, or that you're surprised to hear? Please share them down below. Let me know what your story has been, how your recovery has been. And if you found value in this video, please consider checking out some of my other videos. I have over 500 videos on various physio, exercise, and medical related topics. Until then, we'll see you in the next video. Thanks for watching.